Hey guys, welcome back to No More Cavities. Today we are discussing caries in primary dentition. So, how we will decide that we have to treat a tooth if it is carious or not to treat. So, here we are discussing some reason not to treat. The first is if there is damage. Damage to what? Damage to either the affected tooth, either the adjacent tooth, either the PDL, or either the occlusion. If we try to remove the caries that are present on the affected tooth, we can probably remove the sound enamel. So if these are caries and we are trying to remove these caries, there are chances that we can remove the sound enamel along with it. So if the sound enamel remove, what will happen? Teeth will become weak, or either there will be a crack in the affected teeth. Okay? The vitality can also be lost. The second thing is the damage can occur to the adjacent teeth. So if we are treating the approximal caries, if these are the approximal caries, so obviously we will be treating like this. So this can also affect the adjacent tooth. It will remove the outer enamel layer, this thing. The outer enamel layer can be removed by treating the approximal lesions. What will be the disadvantage of this? Because the outer enamel is actually fluoride rich. So if we remove the outer enamel layer, we will be losing the richest source of fluoride. If we are removing the same approximal lesion, we will also come across the interdental papilla present here. This will also be get affected. So how we will prevent affecting the interdental papilla? By using rubber dam. We have to use the rubber dam so we can avoid affecting interdental papilla. We can also avoid the damage to the PDL as well as to the adjacent tooth by placing stainless steel crown. The fourth thing that can be damaged is occlusion. Why occlusion will be damaged or disturbed? Because if we place any poor restoration here, this will affect the occlusal relationship and change the interocclusal position. There are some other reasons which also lead us not to treat. That are, if there is difficulty to diagnose, we are unable to diagnose. And the third thing is the caries attack is very slow. Most of the time caries progress slowly. And the fourth is that remineralization can occur. If there are enamel caries, so we know that if enamel caries are present, we can probably remineralize them. The fifth reason is that there is short life of restoration. We know that the tooth will be exfoliated, so why we doing a restoration? There is probably the short life, so we avoid not to treat it. Then there are some reasons which enable us to treat the lesion. The first is adverse effect of neglect. So what is adverse effect of neglect? For example, there are caries. They are small and we are not removing them. There are chances that it will in future involve and expose the pulp. There are chances that it can also infect the periodontal ligament, and there are chances that a periapical abscess can result if we are not treating the tooth. And there are also chances that we can lose the tooth if the damage are a lot. The second thing that lead us to treat is unpredictability of speed of attack. Mostly the caries lesion are slow to progress, but in some people it can be fast. So avoid delaying the treatment. The third thing is we can not assess that either the caries are arrested or either the caries are active. When we are unable to decide if they are arrested or they are active, we will treat the lesion. The fourth thing is success when careful treatment is provided. If we are providing careful treatment, there are chances that the tooth will survive. The fifth reason to treat is early treatment is always more successful than late. Again, the same thing, success. If we are treating early, we will avoid the chances of involving pulp, we will avoid the chances of involving PDL, and we will also avoid the chances of losing the tooth and periapical or periodontal infections. So we discussed the reasons of restoring the tooth. But how we can decide it? Either we have to restore the tooth, either we have to remove the tooth. So there are 4 parameters that help us to decide either to restore the tooth or remove the tooth. The first is child. We have to provide best and required treatment to the children. We do not need to consider the need of dentist or the parent convenience. We have to do what is best for the child. The second parameter is tooth. So if the pulp is exposed, any treatment cannot retain it, and the prognosis of the treatment will also not be good. So we will extract this tooth if the pulp is exposed. The third parameter is the stage of disease. If it is early stage or the late stage. If it is an early stage of disease, then we will decide to restore it. But if it is a late stage, then it is obvious that we will extract the tooth. Then the fourth parameter is extent. If the treatment is required for a larger number of the teeth, then it will obviously put the child in strain. So we will avoid to restore it, and we prefer to remove the tooth because the child in strain will not cooperate. So this was all about introduction of caries in primary dentition. Thanks for watching.